We begin with the story we started tracking last week. China's mystery illness. It is spreading across the country. Thousands of people are hospitalized. The World Health Organization is concerned. Beijing says there is nothing to worry about. If all of this sounds familiar, it's because we've been through something like this before. The last time there was news of a mystery illness from China, it turned out to be the Wuhan virus. Millions died and the world shut down. So, of course, there is some alarm this time. But what is this disease and how is it spreading so rapidly? In the last few weeks, China has witnessed a spike in respiratory illnesses, a mysterious pneumonia-like disease. It was first reported on the 13th of November. This was by China's National Health Commission. The disease has led to a spike in hospitalizations across the country. There is a long wait at many hospitals. And the worst hit this time are children. But some adults have also been impacted. On the 23rd of November, the WHO raised an alarm. It asked China for more information. So Beijing has released more details. It says there is no mystery pathogen this time. Instead, there is a mix of pathogens driving this surge. And what are these respiratory pathogens? There is mycoplasma. It causes what is called the walking pneumonia. Basically, your chest X-ray could look worse than you are. Then there is influenza. There are adenoviruses and RSV, which is respiratory syncytial virus.
Our monitoring data shows that the lately infectious respiratory illnesses are dominantly influenza, with additional cases caused by rhinoviruses, mycoplasma, pneumonia, respiratory syncytial virus, and adenovirus. Our analysis shows that the continued upsurge in the acute respiratory illnesses reported recently in our country is incurred by several respiratory pathogens.
I know it sounds complicated, but here's what Beijing is basically trying to say. These are all known pathogens. There is nothing new, so there is nothing to worry about. This illness is not being caused by a novel virus like the one that came out of Wuhan. In an ideal world, this should calm fears. But given China's record, it's doing the opposite. And even if this is not a new virus, it is overwhelming China. The scenes look scary. The biggest hotspots are in the northern part of the country. Liaoning and Beijing are the worst affected. Thousands of people are hospitalized, thousands more are waiting. Hospitals have run out of room for them. Medical facilities are under strain. In Tianjin, for instance, children's hospitals are operating around the clock, and one of them is dealing with more than 13,000 new cases a day. 13,000 cases per day. Another hospital is merging departments. This is to make more room for incoming patients.
Efforts should be made to open more relevant clinics, expand the treatment areas, extend the working hours properly, enhance the supply of drugs, give play to the role of traditional Chinese medicine, improve the treatment capacity, and standardize diagnosis and treatment to the full, and leverage the role of internet hospital and grassroots medical institutions so as to make it convenient for people to seek medical treatment nearby.
So the situation is bad and it's likely to get worse. And I'm not the one saying this, China is. Beijing is calling it, and I'm quoting, an immunity debt. What does that mean? For the last few winters, China was under lockdown. This is the first winter after they lifted the pandemic restrictions, after the end of zero COVID. Those restrictions kept them away from illnesses, but now they're being exposed, and this is contributing to the surge. Beijing says it will peak in winter and could continue till spring, which brings us to the big question. Should you be worried? India says it is monitoring the situation and the risk of outbreak is low, but hospitals and facilities are reviewing preparedness, and it is important to remain vigilant. The world must demand detailed updates from China and regular follow-ups by the World Health Organization. Also be on the lookout for undiagnosed clusters. We cannot afford a repeat of the last time.